America's at a crossroads right now. Everyone wants to get back to life as we know it, but doing that the wrong way can bring a second wave in that will put us into a bigger mess than we're already in. So we're getting a roadmap to reopening for America from a leading health expert and staff writer at The New Yorker who has firsthand what's worked in one of the hot spots in the world. Hey, so please welcome Dr. Atul Gawande. Sunny?
Thank you for joining us, Dr. Gawande. Today, all 50 states have started partial reopening procedures, but the numbers of COVID-19 cases are still rising in some areas. What is the piece, then, that we are missing here?
Well, it is unfortunate that some of the places are opening too early. On the other hand, a lot of places have, including my state, I'm in Massachusetts and here in Boston, the hospitalizations have crested, they're coming down, and in the next week or two, we're starting to reopen. And what we haven't had is a real discussion about how we stay safe out there, and most importantly, how we keep others safe. I think the critical thing for you to know is that there are hundreds of thousands of us that are actively infected, and most of us don't know it. So we all have to act as if I might have this illness and I never want to spread it to anybody else.
Okay. Dr. Trump said 2 days ago that he's been taking hydroxychloroquine, a drug used to treat lupus and malaria that can also have serious side effects like difficulty breathing, dizziness, cardiac arrhythmia. I know that he has issues with heart issues. Maybe he's on a statin or something like that. What do you think? But what do you think his motivation is for promoting this drug when he knows from scientists, and we know that it's not going to work for coronavirus?
Well, it's hope, and that's a natural instinct, especially he's hoping for a miracle like many of us. But you're absolutely right. The reality is that the studies so far have shown, what I tell my patients is the studies indicate that so far we don't see evidence that it's working. We have one alarming study that shows that heart problems are worsened by it. And there are some really good trials that are underway, but right now I wouldn't recommend it. Am I angry about it? No, that the president's doing this? I'm not. I'm much more concerned about the fact that as we reopen, he is often encouraging people to flout public health guidelines. He's embarrassed to wear a mask. I think there's two really important things you got to understand as you go out there. It's the distancing and hand hygiene, but equally important is understanding you want to wear a mask because it prevents you from spreading infection to others. It is also somewhat protective for you, but the biggest value is I'm protecting you when I wear a mask. And it's important that we get out there and do that. We don't need to be perfect. If 60% of us wear a mask that's 60% effective and a double layer cotton mask that fits well, we'll do that. We will shut down viral spread. That will be really important. And then the other thing is symptoms. The president's not talking enough about, and we have to have a conversation about the fact that it can be really mild symptoms that indicate you've got the start of coronavirus, like sniffles or a new sore throat, not just a fever. And those are things that indicate you should stay home, and then you should get a test. And there is more and more availability of testing. You should get a test, and that's really important. And we know it because it's keeping hospitals safe. All these steps, they are working in the hospital setting.
Dr. Gawande, it's Megan. First, I just want to say again, thank you so much for your book, Being Mortal. It has been deeply impactful and helpful to me in my life, and I know so many others that have family members at end-of-life issues, and it's just a really beautiful book. Anyway, we have to move on to the question. Moderna is a Massachusetts biotechnology company, and it's leading an effort to create a coronavirus vaccine, and they announced promising early results on Monday from their first human safety tests. Is this encouraging to you, and when do you think we will actually have a vaccine?
Well, it is encouraging. Frankly, it's amazing. We have now three trials, or initial studies that have already come out from people that have launched vaccines, one in China, one in England, now here in Boston. Each of them have gotten some kind of response. But here's the amazing thing. To get to this point, my vaccine colleagues tell me the typical time is 3 to 5 years. They went from concept to creating vaccines and getting some initial trials underway in a space of just a few months. Now, the timeline has traditionally been, the typical timeline's been 20 years to go from concept to production and testing and then getting it out to, hundreds of millions of people. We're going to need to compress that. I think we're going to be breaking all kinds of records to deliver this in 2 years. I think we cannot wait around expecting the vaccine to be there this fall. There's going to be 100 different vaccines in testing. This is fantastic. And in the meantime, we really got to learn how to take care of ourselves with the virus, live with it, protect one another, and be able to start returning into normal life.